Hello, my name is Dr. Diwan S. Raja. Today I will discuss about Gaucher disease. The Gaucher disease is a lysosomal storage disorder. Okay, a lysosomal storage disorder. This is a genetic disease. A genetic disease. Autosomal recessive disorder. Okay, so this is the disease. A disease due to deficiency of glucocerebrosidase enzyme. A disease due to deficiency of the glucocerebrosidase enzyme. Okay, this is due to deficiency of the glucocerebrosidase enzyme. Okay, and there will be accumulations because this is deficient. There will be accumulation of the glucocerebrosidase and accumulation of glucocerebroside. Okay, we got this will be accumulated in the lysosome. So this is the disease, Gaucher's disease, and this disease is a lysosomal storage disorder, autosomal recessive disorder, a disease due to deficiency of the glucocerebrosidase enzyme and accumulation of glucocerebroside in the lysosome. Okay. Lysosomes are the organelles. Lysosomes are the organelles in the cytoplasm. Organelles in the cytoplasm of a cell. And the main purpose of lysosome is to recycle one of the most important function of the lysosome is to recycle the dead or senescent cells, okay, like that of the RBC, WBC, and dead cells, glycolipid. Okay, so if the glycolipid is not properly recycled, there will be accumulation of glucocerebroside in the lysosome that will lead to the Gaucher disease. Okay, we got that. Then we'll get the types of Gaucher disease. Types. We have type 1, type 2, and type 3. This is the most common type. Most common type, and it does not involve the brain, okay, and it does not involve or affect the brain, okay. There will be no brain pathology here, so we call it non-neurogenic type. Non-neurogenic type, okay. That is non-neuropathic form, okay. So brain is not involved here in type 1, and it is around 99% of the Gaucher disease, and the type 1 is found in Ashkenazi Jews. It is found in Ashkenazi Jews, okay. This is a type 1 type. So what happened in type 1 type? Type 1 type, we had enlargement of the spleen, okay. So spleen will be enlarged, okay, of the spleen, okay. Enlargement of the liver, okay. Then accumulation of Gaucher cell, okay. The Gaucher cells are part of the mononuclear phagocytic system, macrophage with the glucocerebroside, okay. So that is the Gaucher cell. Gaucher, the name came from the French doctor. His name was Dr. Gaucher. So there will be accumulation of the glucocerebroside, okay. We got that. Enlargement of liver, accumulation of Gaucher cell in the lymphoid tissue, like that of lymph node, thymus gland, tonsils, patches of the intestine, okay. So there will be collection there, and certainly in the bone marrow, okay, we get the Gaucher cell. These are macrophages loaded with that of the glucocerebroside, okay. Loaded with that, the Gaucher cell, okay. So there will be enlargement of the spleen. Spleen will be so enlarged, it may go to the entire abdomen. It may be around 10 kg and it may occupy the entire abdomen. Liver is also increased. There will be hepatomegaly, splenomegaly, okay. Enlargement of the liver, so liver will be enlarged, okay. So there will be hepatomegaly, but spleen is large, much more. Spleen will be just, it cover the entire abdomen. It will cover the entire abdomen. Spleen, splenomegaly, and hepatomegaly. So liver will be enlarged. This is liver enlarged. Spleen will be very much enlarged. It will be around 10 kg. It covers almost the abdomen in a patient with Gaucher disease. Okay, liver may go through fibrosis and malfunction of the liver. Spleen will go through infraction, so there will be chance of fibrosis. Here spleen enlarged and there is infraction, possibility of infraction, and that may lead to abdominal pain, abdominal pain due to infraction. Okay, liver is enlarged, so there will be liver enzyme will be elevated. Okay, so we got that. We'll add the bone. Suppose the femur, okay, or any other long bone, there will be accumulation of Gaucher cell and the bone marrow will be replaced. Okay, there will be osteopenia, osteonecrosis, and pathological fracture of the bone, logical fracture of the bone. Okay, maybe tibia, fibula, maybe the femur. Okay, and it looks like a cylinder. Lower part of the femur looks like a cylinder. Okay, so there may be fracture here and there may be infraction here also possible, and there may be also pain, bone pain in the abdomen, pain in the bone, because there may be infraction in the bone marrow. Okay, so there may be osteopenia, osteonecrosis. Okay, so we got the organs affected, not only the spleen, liver. So liver, spleen, very large spleen, bone, especially bone marrow will be affected, lungs may be affected. There will be interstitial lung disease, lungs. Okay, even the kidney system may be affected. So this is very important: liver, spleen, bone. Okay, so that may be contain the Gaucher cell. So how a Gaucher cell look like? The Gaucher or Gaucher cell, how it look like? It is a macrophage with a nucleus here, a lot of lysosome is here, lysosome, okay, these are the lysosome that is accumulating the glucose cerebroside, and under the microscope it looks like the tissue paper, wrinkled tissue paper appearance. wrinkled tissue paper appearance. Okay, so it looks like wrinkled tissue paper appearance. There is the Gaucher cell, that is the pathognomic for the Gaucher disease. Gaucher cell, wrinkled tissue paper or crumbled tissue paper appearance. Okay, we got that. We got the type 1. Type 1 may be silent, it may go slowly, it may progress after many years. Okay, and there is mutation and multiple alleles, so there is always overlapping between the type 1, type 2, type 3, and its manifestation is also variable. Some fetus may die in the uterus due to Gaucher disease. Someone may go up to the adult life, may up to the old age with Gaucher disease. It is sometimes unpredictable because of overlapping and multiple mutation, multiple allele. Okay, we got that type 1 type. Then we go to the type 2, type 3 type. Type 2 type. This is in infancy. It manifests in infancy and is severe form. Severe form and longevity is very low, so it is neuropathic type. It will involve the brain. Neuropathic type. Okay, type involves the brain. Involves the brain. Okay, so we got that. What happened? There will be the blood vessels penetrating the brain. The blood vessel will be thickened. The advantage of the blood vessel that will actually squeeze and dry out the neurons. Okay, so we get type 2 neuropathic form in infancy and very severe form, death by first or second year. So death by first or second year. We got that type 2 type. Then type 3 type, that is also neuropathic type. We should remember that all type of Gaucher disease, all type of involve the liver, spleen, bone, plus type 2, type 3, both of them are neuropathic type. Okay, they will involve the brain. Neuropathic type. Okay, type 3, but they also involve the spleen and liver, bone, tonsil, lung. So type 3 type, it is milder form. It is milder. It manifests gradually. Okay, and but as because both of them involve the brain, so there will be a chance of convulsion or seizure. Convulsion and seizure in type 2, type 3. Convulsion and seizure. That is a possibility to that. And all type of Gaucher disease is associated with increased correlation with that of Parkinson disease. Okay, so Parkinson disease is 20 times more in the Gaucher disease patient. Gaucher disease patient. Okay. So you have to remember that due to lack of that enzyme, there will be other factor that causes Parkinson disease, like alpha-synuclein will be high, So because of decrease in glucose cerebrosidase enzyme, that is the reason for Parkinson disease, 20 times more in the Gaucher disease patient. Okay, more chance to get the Gaucher disease. Okay, what are the signs, symptoms? Signs and symptoms of Gaucher disease. Okay, we got that. There will be abdominal pain due to sequestration of the thrombocyte in the spleen. Okay, there will be pain in the bone pain. Again, there will be infraction in the spleen. Okay, spleen infraction, and also in the bone marrow infraction there also. Okay, you get that. There will be fatigue. Fatigue due to anemia. Okay, it may be just anemia. It may be leukopenia and thrombocytopenia, or all. There may be independent or maybe all together. There may be pancytopenia, that is a possibility also, and there will be bleeding disorder because of sequestration of the thrombocyte in the spleen. So bleeding disorder. So we got these sign symptoms, plus appearance may be coarse appearance in the face because the lysosomal storage may spill out of the cell, and it may make the face coarse, especially in the type 1 type. That also may cause cataract in the eye. Okay, so you got the sign symptoms. Now diagnosis by assessment of the enzyme level. Okay, so assessment of enzyme diagnosis, assessment of enzyme level. Okay, so in the leukocyte or fibroblast, or in the fibroblast. Okay, you can assess the level of glucocerebrosidase enzyme, how much is present there. We can do DNA analysis. Okay, and bone marrow study to find out the Gaucher cell. Bone marrow biopsy to get the Gaucher cell. Okay, that cell contain there is a macrophage that contain a lot of lysosome, too many lysosome containing that accumulation of glucocerebrocyte. Okay, we got that. The diagnosis is there, and we can certainly do the radiological examination, the X-ray of the bones. We may get the bone thinned out. There may be osteolytic lesion, and the vertebra may collapse. There may be kyphosis. Okay, there may be chance of pathological fracture. So that all are the diagnostic tests. But this is always pathognomic, the Gaucher cell. We got that. Now we go to the management. Management is because we had lack of enzyme, so enzyme replacement therapy. by intravenous route, enzyme replacement therapy. We have lack of enzyme, the glucocerebrosidase enzyme is deficient, will have recombinant product of that enzyme you can put intravenously. Okay, this is one. Then substrate reduction therapy. Substrate reduction therapy. So that will decrease the size of the spleen and liver. Substrate reduction therapy. Okay, so we can do that. Then we have gene therapy. And the stem cell replacement therapy for the bone marrow or bone marrow replacement therapy, stem cell replacement therapy. By means of bone marrow. Okay. So there is the transplant of hematopoietic stem cell, you can say transplant of hematopoietic stem cell, So these are the way to manage that. Okay, so again, enzyme replacement therapy, substrate reduction therapy, okay, gene therapy, transplant of hematopoietic stem cell. And that's all about the Gaucher cell. If you like my video, please support my channel, please subscribe me. If you have any question, please feel free to ask me. Please share the information with your friends and have a nice day. Bye now.